So I'll get started straight away. I'm going to share my slides here. So everything is sharing. But yes, so we're going to talk about all things breast cancer today. That's sure to be sharing now in a second. So I'm hoping everybody can see it.
Yeah, it's not on the first slide, Sarah. Yeah.
Oh, okay.
Perfect.
Has it gone back to the first slide now?
Yeah, everything's good.
Brilliant. Lovely. Okay, perfect. So just it's Breast Cancer Awareness Month. October is Breast Cancer Awareness Month. So today, talking about all things prevention and early detection. So I'll get straight into it. Just a little bit of a note at the start, just to remember that this information is gathered from trusted sources and is accurate at the time of presentation. It can, of course, be used as an aid, but never replaces clinical judgment. So if there is something that we talk about or it raises a concern for you and your health after this talk, please make an appointment with your GP. Save your life. As Liz mentioned, it is a recorded event.
You're fading in and out there, Sarah.
Not sound wise, or
yeah, sound. You're back again now.
Oh, okay. Sorry. So just to note that it's a recorded event and that it shouldn't be watched after 60 days, just to ensure that accuracy of information. Okay, so we'll keep going. I'm going to click on through. I hope it's passing through. A lot of you might have been on the call last month, so I just always run through very quickly some of the supports and services that we have as part of the Irish Cancer Society. We hear all the time from people that they didn't know about them when they needed them, or also it's a really good practical support for somebody. We often get questions about how to help or how to support either a colleague or a family member. So sometimes maybe even just signposting them to some of the supports and services is a really practical way of supporting somebody. So the support line, first of all, this is our support line. It is manned by trained cancer nurses Monday to Friday, 9 to 5. The number will be at the end of the presentation, but it's 1800 200 700. This is really, really important for anybody wanting to ask a question or get clarification over something or just want some advice over anything. We also have daffodil centres. These are dotted around the country. There's one in Donegal, there's one in Galway, Limerick, and there's several then in Dublin as well, where there's face-to-face interactions with nurses and volunteers there, and there's a huge amount of publications, and there's patient education courses run through the daffodil centres as well. We provide and fund remote and in-person counselling for anyone and their family going through a cancer journey. Somebody saying they can't hear. So
yeah,
visual, or can everybody hear
me? I can hear you. Okay.
Maybe their own settings just to make sure that settings allow for computer audio and all that kind of thing. I'll keep going until I'm told otherwise. So as I said, we have a huge amount of publications, and the website cancer.ie has a huge amount of resources there as well. We have volunteers are a big part of the society. We have lots of supports and services that are only available because of volunteers. So always want to take the time to acknowledge that and appreciate the work that they do. The survivor support is one of these services. So this is where it's peer-to-peer support, where somebody will be linked with somebody going through a similar cancer journey, and that they can link with each other and talk with each other. Then we have the transport service, which is a huge service as well, and it's growing all the time, and the demand for it is growing all the time, where the volunteer will come and pick you up and bring you directly to your appointment, your chemotherapy appointment, and bring you home again that day. So it alleviates a lot of costs and stresses for people going through a cancer journey. And then, of course, we have our night nursing service, which links with the community palliative care team as well, where it provides end-of-life care in the person's home. So really, really important. So again, just a very, very quick whistle-stop tour there of some of the supports and services. So we'll get into breast cancer. So what does breast cancer look like in Ireland today? So after skin cancer, it is the most common cancer in women here in Ireland. There's about 3,400 women diagnosed every year, and in or around 30 to 35 men diagnosed every year. People are often surprised at that. It's a cancer that affects men as well because it's not hugely talked about, but it does happen. It's rare, thank God, but it does happen. So it's something to just be aware of. There's probably mostly women on this call today, but it is important that men know the signs and symptoms as well. These numbers are expected to rise by over 1,000 by 2045. And why is that? Because we have a growing population and we have an aging population as well. So it tends to be why the reasons why. There is over 700 deaths per year due to breast cancer. So it's important to acknowledge these things as well as acknowledging all the advancements that we've made in breast cancer care and treatment in the last few years. The survival rates have vastly improved at any stage of diagnosis for breast cancer. So what that means is there's an 88% survival rate at 5 years post-diagnosis, regardless of what stage you were diagnosed at. This improves again if you were diagnosed at stage 1, where it hasn't spread to other areas of the body. That improves by up to 97%. So you've a 97% chance of being alive in 5 years' time if you're diagnosed at stage 1 of breast cancer. So it's really, really important that we do know the signs and symptoms, and that early detection piece is of vital importance. Only 5 to 10% of breast cancers are actually hereditary. So again, that's really, really important for people to acknowledge and realize that just because you have a family history, it does not necessarily mean that you are guaranteed to be diagnosed with a breast cancer. It puts you at a slight increased risk, yes, and it's good to know about these things. But in saying that, if we flip that, about 90 to 95% of any cancers are related to lifestyle behaviors and habits as well. So it's just important to know that. So what is breast cancer? Breast cancer is when cells in your breast change and grow in an abnormal way. And that's a very, very black and white way of describing what cancer is. It's the growth of abnormal cells, which can lead to what we call a tumor. When we talk about breast cancer, there's lots and lots of different types. So some are hormone receptive or they respond to hormones, the cells, and that drives the cancer. Or there's certain proteins that we talk about as people have heard of protein that's related to breast cancer as well. There's lots of different types of breast cancer. So therefore there'll be lots of different ways to treat it. Okay, so it's very important, I suppose, not to compare to anybody else's situation or treatment journey. Some women will have to have surgery, chemotherapy, radiation. Some women won't have to have chemotherapy. Some women will have hormone therapy. There's lots of different ways that we can now treat breast cancer, depending on the type, depending on the stage, the grade. There's lots of influences that determine your treatment. So it's just important to acknowledge that as well. Under the types of breast cancer, there's two kind of umbrella terms that we talk about: non-invasive breast cancer and invasive breast cancer. Unfortunately, most breast cancers are invasive, where it has left the ductal wall or the lobules. And of course, non-invasive breast cancer can develop into invasive breast cancer, if not treated at the time. So we move on to risk factors. So again, if you were on the last call with me, we talked about kind of cancer prevention and risk factors. There's two again kind of umbrella terms that we talk about in relation to risk factors: non-modifiable risk factors and modifiable risk factors. Again, I briefly mentioned the likes of family history and genetics in the last slide. That is a non-modifiable risk factor, so it's something that we can't really do anything about, or we can't change or control. But the likes of obesity or overweight, alcohol, smoking, these things we can change and that we can get support with. Why is greater body fat in postmenopausal women such a risk factor for breast cancer? So again, when we talk about body fat, we're talking about the visceral fat in our bodies. Okay, so this is the more kind of aggressive type of fat that we have in our body, and this is it links around our our organs, sorry, I couldn't think of the word, and arteries, and it can speak to our cells. The hormones in this visceral fat can speak to our cells, making them grow abnormally. Okay, so this is why, particularly then when we get to post-menopause, so when we reach menopause, our hormones drop. But if we are overweight or obese, we have that extra supply of hormones there. And as I mentioned, there's lots of different types of breast cancer. So these extra supply of hormones can drive that response into the abnormal cell growth, which can lead to the breast cancer. So again, I hope that makes sense. Alcohol, so there's no safe level of alcohol to drink. There are low risk recommendations. 1 in 8 breast cancers in Ireland are directly linked to alcohol use, not problematic drinking, alcohol use. So as I said, there's no safe level. The low risk recommendations for women is no more than 11 units of alcohol a week, and for men it's 17 units of alcohol. So again, it's just dependent on the level of alcohol in the drink as well. So a unit would be a measured spirit. So a pub measured gin and tonic would be 1 unit of alcohol. A pint of light lager might be 2 units. So it's about making that kind of, I suppose, that informed choice for people. Smoking, again, we all know smoking is not good for our health. It definitely causes cancer. But there are supports and services out there. The QUIT program is available to anyone where they provide that behavioural support as well, and that social support, as well as the free nicotine replacement therapy, so the patch or the gum or whatnot. So it's well worth, if there is any smokers on the call and thinking about quitting or hoping to quit, it's well worth a visit onto the website quit.ie. When we talk about oral contraceptive or the HRT, hormone replacement therapy, these are really at an individual basis, okay? So it's very hard to give kind of general advice in relation to these. When we talk about the hormone replacement, yes, there is a small increased risk of breast cancer with the longer duration of use of the HRT. Okay, but really in real terms, in real world terms, it is a very, very small number. And it varies on the type of HRT used. And it really, again, that will depend on the woman, whether their quality of life is affected or what other risk factors are involved there, okay? Because HRT, there's many, many benefits to taking HRT. Again, of course, as I'm sure lots of people know, it's also Menopause Awareness Month as well. So I'm sure there's lots of educational pieces going around, and it's well worth checking out for anybody who is interested or of that age cohort. But the point here is that HRT, you need to speak to your doctor about it and your individual circumstances. Okay, so your medical history, your family history as well, will all indicate, whether the risk outweighs or the benefit outweighs the risk of taking HRT. Okay, so we'll keep moving. Nulliparity is never having given birth, and late age, first pregnancy as well. So late age, they mean after the age of 30. So again, it's not to panic anyone. I always read that and feel very targeted. I'm over 30 and haven't had a child. But these are things that they are risk factors. There are some research there. But again, back to that point of about 90 to 95% of risk factors are related to lifestyle habits. So the likes of alcohol, smoking, sedentary lifestyles, and diet leading to obesity. These kind of things are where we should really put our focus and where we really have the power to change. So again, just to highlight that in case there is anybody kind of more worried, or there has been a lot of kind of media coverage which can lead to some misinformation for women. Now, this is an old graph. It's about, I think it's from around 2010 from the UK, but the idea still rings true today. Okay, so what it is the comparison of lifestyle risk factors versus hormone replacement therapy. So for every 23 cases of breast cancer diagnosed in the UK, there is 4 additional cases for women who are on the combined HRT. Okay, so but if we link down to the bottom or the second last thing there, for every 23 cases of breast cancer, there's an additional 24 cases of women who are overweight or obese. Okay, so again, leading to that point of lifestyle risk factors have a far greater risk than some of the other risk factors that have been maybe scaremongered in the media and these kind of things. So it's just to be aware of these things. So some protective factors. Breastfeeding, so there's a 2% decreased risk of breast cancer for every 5 months that you can breastfeed. Again, I'm not here to tell anybody what you should and shouldn't do. There's choices there, and there's also reasons why women may or may not be able to breastfeed. Okay, so again, if you can, that is what the research says, that there is a decreased risk. Also during pregnancy, I suppose back to the other point there of pregnancies and have given birth, why they're saying that this is a protective factor is because you have less time exposed to those hormones like estrogen. Okay, so I hope that makes sense to people. So the other one, sorry, is physical activity. Okay, so I spoke about physical activity in our last webinar as well. There is literally no wrong can come from being physically active, okay, or starting to become physically active. Any movement is good movement, okay? So physical activity can significantly reduce the risk of breast cancer. It significantly, reduces the chances of reoccurrence of breast cancer as well as other cancers such as bowel and womb. And as I said before, it has huge benefits for our brain health, our mental health, our gut health, our cardiovascular health. When we what is physically active, I suppose the recommendations are coming from the government and the HSE, says that at least half an hour, at least 5 times a week of that cardiovascular exercise. Okay, so getting a bit out of breath, getting a bit of a sweat on. I would always say to somebody that might sound like a huge amount to somebody who has never exercised before or has no experience or anything like that. So start small, whether that's just going for a 10-minute walk and building yourself up to those recommendations, then that's amazing. That's better than nothing. So any movement is better than nothing, really. And then you can work your way up to those recommendations. And also, it's really, really important that we have muscle strengthening or weight-bearing exercises as well, at least twice a week. Particularly important for women. Again, once we reach menopause, those our hormones drop, our bone density decreases. It's really, really important that we maintain as much muscle mass now so that we can protect our bones when we're older. Okay, so really, really important protective factor when it comes to breast cancer. So when we talk about signs and symptoms, there's lots. We all know to look for a lump, I suppose, or we always hear of the lumps being found, but there's lots of different things that we can look out for as well. So I'll talk through them, and then I'm going to maybe stop sharing for a second, and I'll show my little. I have a prop with me that you'll be able to see. So a puckering of the skin or the breast, so that's like a dimpling or an orange peel effect that we talked about, that I can show on the prop. A lump in the breast or the armpit, a change in the skin around the nipple or nipple discharge, dimpling of the nipple or nipple retraction, an unusual increase in the size of one breast unusually lower than the other, so nipples at different levels, an enlargement of the glands, so in the underarm or up and around the neck, and an unusual swelling in the armpit. Okay, so there's lots of different signs and symptoms and what to look out for. I might just stop sharing just for 2 seconds. Sure. Okay. So I have my prop here. Hopefully everybody will be able to see her correctly. Let me know if you can't, but I think you should be able to on the screen. Okay, so lots of those, as I said, those different signs and symptoms that we're looking for. There's a few things to remember when we're doing our self-checks. We recommend once monthly breast self-checks, okay? What we mean by regularly is that once monthly, okay? A lot of women will say to me, oh, I check every time in the shower, or, I check regularly. Regularly is once monthly. For women who are menstruating, it's typically the week after your period. And then for menopausal women or for women who don't bleed for whatever reason, it's the same time every month. So if you want to put in the first of the month, it's kind of easier to remember. So either putting that in your diary, your calendar, sending it around in your WhatsApp groups to encourage everybody to get involved. It's really, really important, okay? The more we know what is normal for ourselves, the more we're going to recognize when something's not normal, okay? So once monthly, the first of the month or the week after your period. Why we're doing it at the same time every month is to try and get that balance in hormones. Okay, so again, a lot of women will say, well, I naturally have lumpy boobs, or sometimes I have pain, and different things arise for them. So it's really, really important that that's why it's once monthly, so that we know exactly, well, what is normal for me. Yes, I might naturally have lumpier boobs, but I'll know what those lumps feel like. Does that make sense to people? I hope it does. So that's really important. Then before we ever go feeling for lumps and bumps, we're going to look. Okay, so how we check is that we are looking and feeling. So before you get into the shower, you're going to stand in front of the mirror, your hands on your hips, and like that, some of those signs and symptoms that I spoke about, you're going to check, okay, well, are my nipples aligned? Is one breast bigger than the other? That might be very, very normal for you, but it's recognizing it as a change if it's not normal for you. Okay, so one breast might lie kind of heavier or feel more dense compared to the other. These kind of things are kind of to look for. Then I'm going to bring her a little bit closer to the camera. So if you notice on this breast, the nipple has started to kind of sink in or become retracted. Again, often many women are born with retracted nipples or inverted nipples. So again, that might be very normal for you, but if it is a change, you're going to go get it checked out. Or over on this side, we might notice like cracked nipples, bleeding from the nipple, or ooze or exudate. If you notice the areolae going around, it might be kind of darker in color, or it might be bigger compared to the other breast, or just might look different compared to the other breast that you haven't noticed before. Okay, so these are kind of changes to see first. Now again, the lighting might not be great, but I don't know if you can notice that, what I was talking about there, that kind of dimpling of the skin or the orange peel effect. You'd feel it as well as see it along the breast tissue there. And there's also kind of dents along the skin. Again, it might not be very clear on the camera, but when I brush past them, I don't really notice anything. But then when I actually palpate, there's quite a significant lump. So it's to look and feel really is the most important thing. Then we are feeling. Okay, so we're going to get the 3 pads of our fingers. Okay, so not a lot of women come over and start poking into the prop like this, but you would never do that to your own breast tissue because it's going to be sore and uncomfortable. Okay, so it's really important to use the 3 pads of your fingers. Okay, and then when we are checking, I always say to kind of start at the nipple and work your way around clockwise, kind of rocking back and forth, feeling like that. Okay, so medium pressure along the breast tissue. And you're going to go the whole way around clockwise. You can go a little bit harder down the breastbone or along the bone, the rib cage or the collarbone. And then you're going to make your whole way around all the way up to your collarbone and all the way up and under the armpit as well. Okay, really important to do up and under the armpit and all the way up here to the collarbone, because we've large lymph glands in the neck and the underarm. Okay, so you might notice, again, I'm not sure if it's very clear on the camera, but you might notice kind of like a bumpiness or an enlarged gland along here, along your collarbone, or up and underneath the armpit before you'd ever feel a lump in the breast tissue. Okay, so it's really, really important to check the whole chest wall. A lot of women say to me that they never realized about going up to the collarbone or maybe going down your breastbone. So it's the whole chest wall. Okay, really important. There's just 3 different kind of angles that I say to do as well. I say it for everyone. It's particularly important for a larger chest, because you're going to get different access to different areas of the breast tissue, particularly if you are a larger chest. So as I said, you're going to look first of all in the mirror before you get into the shower. Then you can feel in the shower with a soapy hand, or after the shower when you're putting on your socks or your moisturizer or whatnot, you're going to lean forward. You'll just get a different angle of the breast tissue. So obviously gravity is going to bring the breast tissue down a little bit, so you might get more access to this outside area of the breast tissue. Okay, and then the last one would be lying flat at night. Then again, you're going to have a bit more access. Then when the breast tissue separates, you'll have a bit more access to this area of the breast tissue. Okay, so I hope that makes sense to people. I'm going to reshare again and keep going. I hope it's sharing for you now there properly. So that's just that slide. I have gone through that, so we'll click through. And when, so what happens when you do find a breast problem? Okay, so again, much easier said than done, but please don't panic. The majority of breast problems are benign, not cancer, and not related to cancer. Okay, but what we say is do go and get checked with your GP. If they do have any suspicions, or if they just want to clarify any changes like that, or just want to make sure that there isn't anything going on, they will refer you to the specialist breast clinic, regardless of your age. I think I went when I was like 21 when I found a lump, and of course it was fatty tissue. So I still have it. I know exactly what it feels like. I'm not running to the doctor every time I find it. I check at the same time every month. If and when, hopefully never, but if that does ever change, I'm going to know then, okay, well, that doesn't feel normal now. It has got harder, it has got bigger, whatever the change is, that's when I'll go to the doctor. Okay, so I hope that makes sense. So the last thing, I'm nearly there. So breast check then. So we've 3 national screening programs: the breast check, cervical check, and the bowel screen. So breast check is offered to women aged 50 to 69 every 2 years. It's a free service, and it's a mammogram, so which is an X-ray of the breast tissue, basically. Okay, and it aims to detect breast cancer at its earliest possible stage when it is easier to treat. So again, with any of the screening programs, it is not to diagnose it's not a diagnostic test, it's a screening. Okay, so if you do have symptoms in the meantime, maybe whether you're outside the age group of 50 to 69 or in between your mammograms, your 2 yearly mammograms, you notice a change, you're not going waiting for your next screening. You're going to go to your GP and they will send you to the symptomatic breast check clinic then. Okay, so check, update, and register with breast check. So again, most people are automatically registered once they reach the age of 50 because it links with the social department. Some women, for whatever reason, maybe we've changed addresses over the years or that kind of thing, and they might slip through the cracks and might not be invited. So I would always just encourage anybody, you can register prior to the age of 50 as well to make sure that you're proactive and you're ready to go once you reach 50. You can check when you're next due one, and you can update any details then like that if you do know that you've changed your address since registering. That's the number you can ring, 1800 45 45 55, or the website there is breast check. The details are just up the other screen, and but the number is the same for all 3. And I think that's me there. So I'm done. I hope that is okay. I'm going to stop sharing.
Great. Thank you for that, Sarah. I think there's just a few questions. Dara, if you can call those out to Sarah, please.
Yeah, can you hear me okay, sir?
Yeah.
Perfect. I had a few just in there privately. Is doing a self-exam enough, or should you ever go to the GP for an exam?
What I always say is you're the expert of your body. Okay, so it's really, really important that we get into that habit of doing the once monthly checks. Okay, then of course, if you notice something that's off, then absolutely go to your GP. If you feel like, okay, well, I'm not sure what is normal for me, because again, a lot of women will say, oh, well, I don't bother checking anymore because I'm so lumpy as it is. You know, these kind of things I'm hearing all the time. So absolutely, when you're in with your GP, then maybe ask them to have a check. But the most important thing is that you know what is normal for you, because you know you're the best person to know what's normal for you, so you can recognize then when something's off. So it's absolutely more than okay. And even when we are attending our 2 yearly mammograms, it's still so important for those monthly self checks as well, because a lot can happen in 2 years as well. So I would say that, yeah. All right.
Perfect. The next question there was just about the age that the screening process starts. I think you just answered that there just on your last slide.
Sorry, yeah. So age 50. Now, of course, we are always trying to advocate to reduce that, because, you know, we're hearing of a lot more women being diagnosed under the age of 50, but the majority of women diagnosed with breast cancer are over the age of 50, but we are trying to advocate to lower that. But yes, it does start at 50 and up to 69.
Brilliant. And then there's just another question there. Is there anywhere, I suppose, on your website or a link that we could circulate that will show maybe that examination that you did on the model?
Yes, I can send it on to Liz afterwards. I think I was meant to, and I may have forgot, Liz, sorry. But yes, there is YouTube videos. There's a few YouTube videos from the Irish Cancer Society website that will go through the demo on the prop as well. Yeah. I'll share it with Liz afterwards.
Yeah. So I have the link to the Irish Cancer Society on the email that's going out to everyone with the survey. And I also have the link to Breast Check on it, which as well has some videos showing a self-examination.
Super. And then that next question, as you just answered, so how do we let colleagues know, etc., so we can circulate that there. And then any other questions? Sarah, you actually answered as you went there, kind of just preempted your next slide, so we're all good now.
Oh, great.
Okay. Thank you so much.
Great.
That is great. Thank you very much, Sarah. And we're pretty much bang on time. So it's a nice short input, 30 minutes. And I suppose I would really encourage everyone to complete the survey that you'll get by email. It literally is one minute, and we will obviously look at the type of webinars and the topics that you're looking for, and we'll bring those to you as part of the Staff Health and Wellbeing Programme. So again, really big thank you to Sarah from the Irish Cancer Society. It's great to be partnering with the Irish Cancer Society, and a big thank you as well to Dara, my colleague in Health Promotion. Thank you, everyone.
Thanks
everyone.
Bye.
Bye. Have a good day. Thank you.
Bye-bye.